Let's talk about the benefits of the CPM machine. Most patients tell me that the biggest benefit that they feel from the CPM machine is that it helps to decrease their pain. And that's because it helps to reduce your swelling. So as you bend your knee, basically what it's doing is it's working like a pump to pump that swelling out. The other thing that it's going to do is it's going to help you to maintain and increase your range of motion. And it's important to note here that you're going to be doing some exercises while you're at home that the doctor's given you, and you're also going to be seeing a physical therapist hopefully too. So what this machine will do is it will help to maintain that range of motion that your physical therapist gets and or your exercises that you're doing at home. So keep that in mind as far as that goes, and definitely follow your doctor's orders. He's done this procedure many, many times, and it's really important that you do exactly what they say for you to do. We recommend that you use this machine for about 8 hours a day, and you can use it more than that or less than that. It's passive motion, which means you're not using your muscles. So as long as you're getting your exercises in, you're getting up and walking around the way you're supposed to, you can use this machine as much as you want. So it decreases pain, it helps to maintain and increase range of motion, it helps to keep your blood supply flowing. So as we do that pumping action of bending your knee, we're going to help to increase the amount of blood supply that goes to your knee so it heals better. Let's talk about the different components of the Phoenix Knee CPM. You of course have a power supply that gets plugged into the wall. You'll also have a hand control. This hand control we'll talk about more in a future chapter of this video. But basically you're going to have controls for your flexion, your extension, your speed, and if you want to have a pause, you can put a pause in there too. If you loosen these screws up right here, this will just flip up like this. And this will make more sense in a second as we go through how your leg sits in the machine. You'll notice the machine is fully padded. There's an extra long tail here at the back, and this is for you to sit on, or if you want to get it out of the way, you can flip it under the machine like this, and it just covers everything up. You're going to be sitting here, your knee is aligned right here, and your foot goes into this foot plate. There's 4 adjustment points that you'll need to keep track of. One is where you put these knobs in at the front. That's going to adjust this bar, which is going to come forward like that. This is basically designed so that if you're in your bed or in your couch, you can elongate this bar so that it hits the end of your bed so that the machine is real stable. It's not going to go forward on you down towards the end of the bed. And you may find that you don't need to use this adjustment, but realize if the machine starts to move away from you when you get into those bigger angles of flexion, that component of this machine is here. The next part that you may need to adjust is your foot plate. And you've already played with the foot plate a little bit, but keep in mind that you can adjust the foot plate down here or way up here so it's exactly vertical. So I like to keep mine like this, so I'm going to put it there and then tighten the knobs. The next point that adjusts is this lower section for your lower leg. So your knee is going to be here, and your foot, of course, here. So remember that your leg is going to be lifted by where this pad kit sits, not by where the foot plate is. So you'll loosen these 2 knobs here, and you'll see that this will telescope out like this, in and out. So in doing that, just get it so that you have that finger's width worth of room, and then tighten it up, and the lower section will be set. The next section to adjust is your upper leg or your femur length. So we've taken the pad kit off of this machine to explain the femur length adjustment a little bit further. Basically here we want to loosen these screws, and remember the femur length is the length of your upper leg. So we're going to lengthen this. If you're a really tall person, if you see right here, this is where it telescopes in and out to become longer and shorter. Basically if you're a really tall person, you're going to want to lengthen this as far out as you can go. Okay? And that's going to be for somebody with a tall leg. If you have a medium-sized leg, just do about halfway in between. And it's definitely important that you get these lengths even from here to here and here to here. Your machine will work much better if you do it that way. Then if you have a really short leg, go ahead and just scrunch it down as far as it'll go, and then tighten these up. And that way your leg will fit in there just right. So if you have a hand control like this one, You can adjust the flexion, which is where your knee bends. You can see right here it says flexion or flex with a bent knee. You can adjust that by just turning this dial and just turning it to wherever you want. Like here I've got it set at 60 degrees. Then the next knob down is for your extension, and that you're going to leave set at 0 degrees. Your next knob is speed. You can bring that up. The faster you have the machine go, the more it's going to do for you, so try to work it as fast as you can. And then on the bottom is your pause. The top knob right up here, this red knob, is your start and stop knob. You can start that to get it to move, and then press it again, and it'll stop. So first thing you'll notice when you have your leg in the machine is that your knee needs to be even with where the knee hinge is. So go ahead and line your knee up so it's right even with where the machine bends in the middle. As you can see now, as the machine bends, my knee is even with that point. The next important piece of information that you'll need to know is sometimes you'll be going up and you'll feel a little bit of extra stretch. And if you keep the hand controller close by, you can just turn it off. And then if you turn it back on, it will always go the opposite direction. So if you turn it back on again, it'll start bringing you down so that stretch will go away. So the leg strap goes around your thigh like I have it here. Just wraps under the machine, wraps up around your leg, and then you just tighten it around your thigh. And you get that nice and snug, and that helps you with your extension. When the machine goes flat, you may feel that pull just a little bit more. If you decide to use your CPM at night while you're in bed, keep in mind that you don't have to keep it at full flexion. Say you're at 90 degrees of flexion during the day with the CPM machine. Probably as you're sleeping at night, that won't be as comfortable to sleep with. We recommend that you turn the machine down to somewhere between 45 and 60 degrees when you sleep at night. It's a real comfortable motion, and what that will do is that will help to decrease that amount of swelling that occurs as you're immobile at night, as you're not moving while you sleep, so that when you wake up in the morning, you're not going to feel real stiff from all that swelling. It's going to help to decrease that swelling for you. So keep that in mind. At night, you don't have to have it up at that full flexion level. You can decrease it down so it's a little bit more comfortable.